I am truly humbled and honored to be standing with you guys today. For the last 20 years, I have dedicated my career to working in Medicaid. For 3.5 of those years, as the governor stated, I've had the pleasure to serve alongside the former Director Kerr. I could not have had a better role model or mentor. I've had the opportunity to work closely with him to set a new strategic direction for the South Carolina Department of Health and Human Services. We have worked hard to keep the talented staff we have at the agency, evaluated where we needed additional capacity and expertise, and hired for those positions. This has allowed the agency to be better stewards of taxpayer funds by better accessing, analyzing, and acting on the data needed to make sound decisions. This approach has helped inform some of our historic work over the last couple of years to ensure Healthy Connection Medicaid members have access to services. During that time, we have overhauled the state's school-based mental health program, which has doubled the number of mental health counselors available to students. We've streamlined Medicaid preferred drug lists to a single state-directed list, which we project will save the state more than $21 million each year. Invested more than $150 million in state funds in behavioral health infrastructure to build additional capacity across the state. We've improved access to services with targeted reimbursement rate increases for providers and added coverage for more than 10 new community-based behavioral health services. This is a list of accomplishments every South Carolinian should be proud of, and it brings me to where we are today and my vision for where to take this agency. At its core, the agency's role is to purchase access to healthcare services for the most vulnerable individuals in our state. The Medicaid program currently serves approximately 60% of the state's children and about 60% of births. Additionally, a significant number of South Carolinians with disability are enrolled in the program. Given this large footprint, we have a responsibility to these individuals in Medicaid to better streamline how services are accessed. We can do this by continuing to support our disability community by not only investing in those who provide care, but also funding more slots for Medicaid waiver programs to allow more people to receive care in their community. Continuing to evaluate behavioral health services to ensure we have access to the right care in the right setting. Enhancing case management and care coordination to make it easier for families to navigate the health system. Investing in the state's future physician workforce, continuing to work with a dedicated and talented team at HHS to ensure we have well-trained workforce with the resources they need to carry out our mission, to be boldly innovative in improving the health and quality of life for South Carolinians, and continuing to collaborate and work with our partners in the community, other state agencies, and families to find more efficient ways to improve outcomes for our citizens in need. Thank you again, Governor McMaster, for the faith you have shown in me by nominating me for this position. I look forward to earning this position through the confirmation process. Thank you.